Welcome to our next episode of Diagnexia Dialogues, which is a podcast related to matters on pathology, specifically to diagnexia, and the changes that we make and the innovations that have come about recently. So this morning, I'm delighted to be joined by two new staff members, Sarah Hughes and Josh Wood, who have kindly agreed to participate in this podcast. And perhaps I'll start with you, Sarah. Can you just tell me quickly why you went into being a biomedical scientist? What were your inspirations?
Yeah, so I first heard about biomedical science when I was about 17. I would do work experience, and they, the lecturers from De Montfort University came around our school and said, oh, you could go and have a look around the labs. So when I went, I had a look at all the different labs at Leicester, and the one that stuck out to me was histology because it was still very hands-on. Everything else was machines. So yeah, that kind of stuck with me. And then when I was picking my A-levels, I made sure that I picked the ones that were relevant for biomedical science. So that's kind of how I got into the field. And I was quite lucky when I was applying for biomedical science, they were doing like a sandwich degree. So I did my degree, and in my holidays, so Christmas, Easter and summer, I did my state registration portfolio at the same time. So when I finished the 3 years, I was a state registered biomedical scientist and could go and work as a Band 5 in any hospital or private sector.
Excellent. And how about you, Josh?
So I actually fell into the career a little bit unexpectedly. Originally, I was going to go and do pharmacy, but then decided that it wasn't for me. And on the back of talking about career choices, one of my dad's friends was a biomedical scientist. So she was like, come along, have a look in the lab, see what you think. It might help you decide. And that was when obviously I was introduced to histology, to dissection, and it just fascinated me really. So from picking what degree I wanted to do right the way through, I was adamant that I wanted to do dissection. This was the way that I wanted to go. So then I chose to go and do my degree at Aston University. I did similar to Sarah with the placement year. I did my IBMS registration portfolio. And then upon graduation, I was a state registered biomedical scientist, and then I just followed the path.
So when did you start career-wise?
So I did my degree at Aston University, and during that time I was at Walsall Manor Hospital as a trainee BMS. So I did a year there, obtained the portfolio, and then went back for my final year of my degree. But I carried on working there as a medical laboratory assistant during the final year of studies. And then after that, then I was lucky enough to get like a trainee specialist position in pathology at Birmingham City Hospital. So I was there for, I think it was about 6 years in total. So I did my specialist diploma there, and I also did my MSc there, my master's in cellular pathology there. And then I was part of the Black Country Pathology Services merge, where the 4 trusts in the Midlands merged over to New Cross Hospital. And then at that time, then I was lucky enough to get a senior biomedical science position across University Hospitals Birmingham, working between Hartlands and the Queen Elizabeth. And that was where the bulk of my dissection training and the expert practitioner qualification comes into it.
Okay, I'll come back to that. And Sarah, how about you in terms of your experience and get to the point?
Yeah, so I started in my holidays as a trainee at the University Hospitals of Leicester, and I worked across the 3 hospitals. And then when I finished my degree, I then got a Band 5 position at Nottingham University Hospitals, and I worked cross-site at Queen's Medical Centre and City Hospital. And during that time, I completed my MSc in cellular pathology alongside my specialist portfolio. So I worked there for about 10 years and did all the different rotations. So I did neuro-peds, I did all the muscle service, and then all of regular histology. Then I came back to Leicester as a Band 6. And worked there for about 6-7 months, and then got a senior's position at Leicester, and that's when I started my dissection portfolio. So I started my diploma of expert practice. And
what drove you in that direction?
In dissection? Dissection for me, when I started it, right at the beginning of my career, when I was scribing for the medics, I always found it fascinating of why they took certain blocks from certain areas. And as I learnt more about the different sites that they took it from and why the margins were important, I really thought that that could be an area that I could go into. And as I saw the journey develop in the IBMS, that it became a structured pathway that you could go down as a scientist, that really tweaked my interest. And having been through like the immunohistochemistry, electron microscopy, that wasn't what tweaked my interest as much as dissection.
How about you, Josh?
Very similar story, really. Yeah, the fact that dissection was so hands-on. When you're obviously fully trained and competent biomedical scientist dissector, you do hold that clinical responsibility as well, which is unique and different to other areas of the lab, which are becoming more and more automated and a bit more factual-like. So it was the hands-on, the clinical aspect, the being part of the wider sort of clinical team, having that extra bit of knowledge to do with obviously treatment, patient pathways, clinical guidelines, those sorts of things. It was
so it is a delegated medical responsibility that the pathologists give to you. How do you view that in terms of, the way you approach your job and your interaction with the pathologists?
So obviously it's a huge responsibility to have. The pathologists obviously have the overall say, but it's nice to know that you are competent and trusted enough to be given that responsibility, and that they put their faith in you, because they're not going to see every single specimen.
Correct.
But they have that faith in you that you've been trained correctly, you are capable, you have your own autonomy, you have your own sort of mindset and skills to be able to deal with everything effectively and competently, as they have been trained as well. So it is really nice knowing that people like that do trust you to do that.
In terms of the certification required, Sarah, what's the actual steps involved to get to the point that you're at?
So to do your diploma in expert practice, you have to accumulate 2 years worth of numbers. So you can start at any point, but you must be a specialist biomedical scientist to start. Then you have to collate 2 years worth of numbers, and it involves you having to do your dissection, review cases with the pathologist. There is no set amount because it depends on which hospitals you're working at. You have to do some case studies. So you do one case study per module, which starts at pre-analytical, so how the patient presented, all the way through to MDTs and things like that. And then you have to do like reflective learnings, going on training sessions, and then part of it is your quality management side. So you have to do audits and things like that to show that you have learned a lot of different aspects in your career. Once you submit that portfolio, it goes off for assessment. And then depending on that, you either get passed or they might ask you for additional evidence. Then you have to sit an exam. So it's 2 papers of exams.
Right.
And then if you complete that, then you get your diploma in expert practice. But you don't have to submit all your modules at the same time. You can submit a few and then add top-ups, which is what I did for breast, because at the time when I was learning breast, I hadn't got enough numbers to submit that at the same time I was doing my dissection portfolio. So I did it as an additional module alongside doing my malignant work. So submitted that, because you can't do your malignant portfolio unless you pass your benign portfolio. And then the malignant portfolio, the advanced specialist diploma, is very similar to your benign portfolio. The only addition to that is the depth of knowledge you have to have, because it's one specific discipline. So I did mine in breast, and you have to attend MDTs. You have to get involved in more discussions with the consultants, with the wider team, with radiology. I spent a lot of time in radiology and theatres to see the full patient pathway.
Okay.
And then you have to sit an exam, and then you have to do a viva as well to pass it.
In terms of your dissection expertise, can you just enumerate what you can do in breast specifically and outside of breast as well, so viewers can see what your skill range is?
Yeah, so in breast, I can do pretty much every specimen. So all the malignant specimens, so neoadjuvant chemotherapy, mastectomies, wide locals, axillary node clearances, margins, and then all the benign work to go with it. I can do all the lumpectomies for BRCAs. So the full range of specimens for breast, I can do all of them unsupervised. And then all the benign work. So I passed my modules I passed 7 modules. So I did GI, gynae, skin, bone and soft tissue, cardiothoracics, urology, and breast. So all of the benign work associated with those disciplines I can do, which ranges from like an appendix to ischemic bowels. So there's a huge range of specimens.
And how about you, Josh?
So I hold the certificate for expert practice in skin, GI, and hepatobiliary. So when I was working across the 2 sites, they were the most common sample types. So when I was studying, it made sense to study towards the specimens that I was going to have the most types of. But then each site then also had their own specialities. So Heartlands, for instance, they did gynae, which the Queen Elizabeth didn't do. So I was also helping to dissect some of the gynae specimens. So that would include products of conception, fallopian tubes, things like that. But then over at the QE, it was a lot more specialist. So I did a lot more complex stuff over at the QE. So I was involved in doing metastatic liver resections, thyroids, inflammatory bowel diseases. And then I also worked for about a year and a half for the Royal Orthopaedic Bone Service. So we did a lot of amputations, and I could trimble to metastatic bone disease, which was obviously really interesting. But I didn't officially submit any of those modules as part of the DEP because, again, it was like a numbers sort of situation. So over at Heartlands, I did some gynae, but not all gynae. Over at QE, I did some bone, but not all bone. But I will obviously interview.
Does that preclude you from doing certain specimens then if you haven't submitted the module?
But no, I wouldn't say it does because obviously I hold competence from NHS and I've received the appropriate consultant training.
Good.
It's just a case now of any specimens that I lack, I just top up that competence with and then formally submit.
Right.
So there's a whole wide range of specimens across all modules that I can do. So for instance, over at the QE as well, I did a lot of neuropathology, but I didn't do any muscle pathology. And the IBMS, their module is neuromuscular. So I could do the neuro side of it, but not the muscle side of it. So technically I couldn't submit for that module, but then I'd be more than competent to handle neuropathology specimens. So there's a lot of grey areas. I know the IBMS certificate of it, like the expert practice is obviously very good, but I wouldn't say it was the be all and end all in terms of.
And so clearly you know the limits of your discretion as well, and you'll converse with the pathologist if necessary. You both alluded to a career path, right? How well established is this advanced practitioner role in dissection in the UK?
I think it's a well-known pathway now. I think it's a lot of the new BMSs coming through. They are well averse to this being a normal pathway. Dissection is a normal pathway. I think the majority of centres in the UK are BMS led now because of the shortage in pathologists. So I think that's a normal pathway for BMSs to go down.
Are there jobs available?
So I think from my experience, there are Band 7 roles. The higher grades, they're a little bit more few and far between. But there's not that many people who currently hold the advanced specialist diploma because it's a tough one to get through. And the supervision you need from the pathologist and the input you need, it's time consuming. So it's sometimes quite a challenge to get that level of input as well.
Right. And in terms of maintaining your certification, Josh, what are the hoops that you have to jump through in terms of continuing professional development?
So you just maintain your practice, maintain your competencies, obviously ensure that all of the specimens that you're competent in, keep doing, routinely do them. Obviously, if there's any changes to any guidelines or anything like that, bit of self-directed learning, ensure that you're staying up to date with the guidelines, SOPs, discussions with colleagues, discussions with consultants, things like that. Obviously, in terms of development, if there's things that you can't do, obviously seek help, seek advice, and develop that way. There's plenty of courses out there as well, such as like the NEPSET course. That's really useful for learning about dissection and anatomy and things like that. I went on that during my portfolio, and that was a very good course to go on.
And given the combined expertise you both have in terms of us becoming a training center, is that something feasible and that both of you would be keen to do?
Yes, definitely. It's definitely been something that we've been discussing quite a lot, that we would like to push forward with, because between us we have quite extensive knowledge, and it would be really good to share and develop the service.
Yeah, we're totally supportive of that. And I think we mentioned it when you both interviewed. In terms of organization of advanced practitioners, like in North America, we have the Pathologists Assistants Association. Is there something equivalent in the UK where, it's catered for specifically for people in that particular category?
We don't have a specific for dissection. The only thing we really have is the IBMS, which is the Institute of Biomedical Science. We don't have something specific for dissectors, but you'll find a lot of the institutes courses that you can go to, like Congress. There's a lot of dissectors there, so you usually touch base. And like Josh said, like I went on the NEPSET course and made quite a lot of contacts across the country of sharing information and things like that. So we don't have a specific group.
It'd be nice to have.
It would be nice,
I think
It has to just form your own sort of things.
The Canadian Association of Pathology has a pathologist assistant branch, and I'm sure IBMS could facilitate that. How many approximately in the UK advanced dissection practitioners are there?
It's hard to say, really. So across my two hospitals, I think there was 7 of us. So it's quite unique. Like 7 members of staff between 2 trusts that hold the qualification. It's quite.
Yeah.
If we had to guess, approximately 50 in the whole of the UK. Probably more than that.
Yeah, I think my cohort this year on the NEPSET course was around 20 people.
Okay.
So if you say about 20 people per year are doing it, it might have failed.
200 maybe.
Oh, that many. Okay, I mean that's good to know.
They're becoming more common.
They're more common now. But it's the because a lot of people don't submit multiple modules. They submit maybe 1 or 2, because someone at a district general hospital can submit, but they might submit just 1 module. Whereas you can have someone from a teaching hospital that may submit all 11 modules. So it's dependent on experience as well.
But you would say there is a demand amongst BMSs to do,
doesn't it?
Absolutely.
Good.
Every course that I've gone on recently, I went to a lot of the breast courses last year, that is all pushing for the pathologists to step away and allow the BMSs to dissect, because there is such a shortage of them that there seems to be a real need for it at the minute.
Good. Now shifting gears, so you both worked in the NHS, a very different structure to the private sector, and you've joined Diagnexia, where we're really pushing for automation, use of AI, etc. How does that impact on the way you view your field, Josh, in terms of the way you practice?
I think it's really positive, actually. So we're just undertaking the testing of the Alboscope, which is a AI grossing stations. Will be the first lab in the UK, I believe, that will be using this piece of equipment. So I think it's really positive, because it allows us as expert practitioners and advanced dissectors to then focus on the more complex things that need more user input and manual dexterity to handle. And then it frees up then the lower grade members of staff to utilize this AI and to then do the throughput of the high volume specimens that don't obviously need so much sort of brain power behind them. So I think it is really positive. And then in terms of the AI algorithms and the measurements and things that the software is capable of, it really does minimize that measurement of uncertainty and really documents from the second you put the pot on the dissection bench to the moment you close the cassette. It audits every single step, all of the inks, all of the measurements, all of the descriptions, and it just gives this all-in-one view then to the pathologist alongside your standard microscopic description. So I think it's really good. I think it's really positive.
So you used it in that. In general, per specimen, let's say a small specimen, how much time is it shaved off in terms of?
Previously, because a traditional assistant and dissector, you're talking 2-3 minutes per specimen. I'd say you're half that with this piece of equipment as we get up to speed with it, and you don't need an assistant. So you save on another person, which is a massive change. And ultimately, as a dissector, you are fully responsible for that specimen from start to finish, which for me personally, it's a great step, because a lot of the time you have lag steps when you're dissecting, and you've got to check everything in your assistant, what they're doing. And naturally, people get distracted by things that are going on around them. But when you have this piece of equipment, it tells you that you've done, like, you've got the wrong cassette or you've got the wrong part. So it really does take that level of error out, which is great for patients as well.
I think elimination of error and a zero error clinical service is what we're aiming for. And so every little bit helps from beginning to end of the process. Absolutely. And in terms of your own ideas, have you thought about how, we could refine and tweak and do things better in your short time here so far?
Yeah, I think there is a few things there just to streamline some of the processes, that to try, because we're obviously getting specimens from lots of different places. So it's trying to get little batches of work through instead of like we get a lot of specimens from one and we're trying to book everything in the same time. Is to trickle the work through so that we've always got a constant stream of work to dissect, then to go on the embedder. And we're working on, for the next couple of weeks, we're hoping to get day runs on, so the small biopsies can be turned over even quicker. We're not waiting for the evening runs, so that we can turn those specimens over even faster.
Yeah, that's excellent. Well, and finally, thank you both for your time, and I really do appreciate you speaking to us and also conveying your skills and what we can offer as a wet lab service. What do you do to relax, Josh?
To relax. So to be fair, I normally like to go to the gym. I try and go to the gym. I've not been too good lately though.
Enjoying the club.
Yeah, but just to the gym really. Used to do a bit of martial arts in my spare time. I was quite accomplished in that in my younger days, but again, not so much anymore. And then now I just potter around the house. Now the spring's here, I'm developing a bit of an addiction to gardening. Slowly, just getting the garden ready for the summer.
Yeah, gardening can be therapeutic, I'm told.
Yeah, but that's it really.
How about you, Sarah?
I have 2 little kids, so relaxation is usually like wrestling around the house, or like I really like curling up with a good book. That's my kind of like my own time is doing that. Yeah.
Fantastic. Well, thank you both very much. It's been very informative and enjoyable. Thank you.
Thank you.
Thank you.